let's show your listeners for a second, okay? So, Rachel,
Yes.
we've talked for a few minutes about your anxiety about being a nurse practitioner, and we decided that Prozac was a good place to start. But I'm also just wondering if you want to talk for a few minutes about that anxiety and how that's affecting your life.
Yeah, it really I kind of just have this knot in my stomach when I go to work, because I'm just afraid that I'm not going to be doing a good job, and sometimes I feel like people are judging me, and it kind of makes it hard to focus.
I get that. And when you think about that feeling of just being judged and having it be hard to focus, how do you feel like how does that affect your life? And what's your day like when that's part of it?
I guess it kind of just makes me scared to it makes me second guess all my decisions. So
Mhm.
it takes me longer to do everything because I'm always like just second guessing everything. I can't really be fully present with my patients because or even with my coworkers because I'm just sort of worrying all the time.
Yeah. Yeah, and like that second guessing that you're describing and you say it so well, like it's like you're second guessing, you can't be confident. Does that feel like is that Rachel's whole life or did that really just start as an NP?
Oh gosh. I think it definitely got a lot more pronounced as an NP. I
Mhm.
think I was already a second guesser, but
Uh-huh.
when I got into this role, it got a lot more pronounced.
Yeah. Do you feel like second guessing was something that you saw growing up? Did a parent second guess? Do you feel like someone who was important to you that was just the environment you were raised in?
Well, I kind of felt like my parent didn't second guess enough. So
Uh-huh.
I needed to be the second guesser.
Uh-huh.
Like I needed to be worried about these things because there wasn't anybody else worrying about them.
Yeah, so really second guessing for you became like a coping mechanism. Like this is what keeps me safe. This is what makes it so that things run smoothly. Because when you
Hmm.
say it like that, can't you see how then of course you second guess, right? Cuz right? So all right, so we'll stop here. So Rachel, how did it feel just having me kind of ask you these questions about anxiety in your life?
It made me have to do some work and think about
Mhm.
how it's actually affecting me.
Mhm.
It definitely made me feel less pathologized and less
Mhm.
like a checklist of symptoms because I was
Mhm.
like actually reflecting on how it impacts me in my day-to-day life.
Mhm.
And then I felt very validated
Mhm.
when we kind of looked back at, oh,
Mhm.
maybe this is why. Maybe this is
Yeah.
contributing to that.
Yeah. And, for many of us, I feel like those kinds of questions actually do come kind of naturally, but we get so freaked out about, was that CBT? Was that motivational interviewing? So, but what I was doing was being curious and validating and compassionate, giving you time to answer, expressing interest in you, encouraging you to reflect on your own experience. And that's psychotherapy. And that did not come from a certain textbook. That came from me paying attention to you. And
Mm.
so I think if we just start there, and
Yeah.
most of us feel trained in that, maybe not confident, but we start there and then you can expand after that, you know?
I love that. I love that validation piece to validate that, like, hey, that makes sense why
Right.
you second guess, like, would create an atmosphere for me where I would feel safe.
And we can, if you want to take a couple minutes, I can show you, for example, show your listeners how with a few quick, easy question changes, we could be going down a different road. We won't go all the way down that road, but let's just say hypothetically that I say, um, so Rachel, if between now and a month from now, you wanted to feel more confident as a nurse practitioner, what would you do different?
If I wanted to feel more confident next
Mhm.
month,
Yeah.
I think I would probably want to practice psychotherapy more.
Mhm. Yeah.
Yeah.
And if I were to wave a magic wand, right? And when you woke up a month from now, you could tell things were different. You just knew you were a more confident NP. Paint that picture for me. What would it look like?
I think I would go into work really like energized, and I would kind of know, I would have an idea of like the plan I was going to have with my patient, and or the way I was going to guide questions. And I think I would feel a lot more energized and present, and more directed in what I'm doing, less like I'm floundering.
Yeah. And so on a scale of 0 to 5, with 5 being really ready and 0 being not ready at all, how ready do you feel to make this change, to take these steps to being more confident?
Oh, I feel like I'm a 5.
And what kept you from saying a 3 or a 4?
Because it's just so important to me to develop this skill. I see how much it impacts people to go to a psychiatric appointment and not feel heard and not feel validated and not feel like they're being listened to or making progress. I've seen that happen to loved ones that have been, waited so long to get help and gone through all these hoops, and they go to the appointment and the person just dismisses them
Yes.
and gives them a prescription. And I don't want to be that.
Right.
And I know I won't be that, but I really want to be just really excellent at what I do. And
Right. So what I've heard today is that you are very committed to making this change, to going to get this education that's going to make you confident. And you want to make this change because it means so much to you to be able to heal your patients. And you want to wake up a month from now and feel like you can walk into that visit feeling more present and able to focus. Would you agree that that's where what kind of came out of today?
yeah, that sounds right.
Yeah. So what did we just do? What therapy?
That was that motivational interviewing?
Yeah.
Yeah.
So I could now document 17 minutes of MI-based intervention focused on helping reduce Rachel's anxiety. And those questions, yes, you have to go to a couple classes in motivational interviewing to kind of learn those questions to ask and those skills. But you do not need to go through a 6-month, $18,000 training in motivational interviewing to be able to kind of use those based interventions, right? And then the same would be if I said to you, Rachel, I'm hearing you say that you're a terrible psychiatric nurse practitioner because you're not comfortable prescribing antipsychotics. And I see that as, that kind of all or nothing thinking that we talked about the last time we met. You and I have done CBT together. Do you feel like there's a way you could rephrase that comment that would maybe be more validating?
Yeah. If I could, if we had done work together and everything before, and I understood those concepts, it would probably sound something like, I don't feel comfortable right now prescribing antipsychotics, but I know that with some more learning, I can become more comfortable with it.
Yeah. And when you say, I'm a terrible nurse practitioner because I can't prescribe antipsychotics, on a scale of 0 to 10, how anxious do you feel about your prescribing?
Like an 8 out of 10.
And when you say, I'm not yet comfortable prescribing antipsychotics, but I feel really confident with antidepressants and therapy, how anxious do you feel 0 to 10?
4 out of 10.
So I've just helped you go from a 8 to a 4 on using a few CBT-based skills, which again, a 2-day course, very focused on CBT, some reading on CBT, your own time spent doing a CBT-based workbook. You can get there. You don't have to be Freud. You have to be able to use certain techniques with your patients, but you don't have to be Freud.
I love that.
I don't want to be Freud. I don't want to be him.
Yeah, he was very odd.
Now, for the highly anxious new grad, new Psych NP, who's listening to this and going, okay, I hear what she's saying. Maybe I could try it out at this next appointment. What's the worst that could happen? Because that's what we ask ourselves. That's what I ask myself when I'm anxious a lot of times. And I run through that and then I'm like, okay, could I survive that? Yes. Okay. Yes. You know, and I think with nursing school, it's like, well, the worst case is you probably kill somebody. So there's like this like trauma response of like trying something that we're unsure of.
Yeah. Well, and I think that's a good question. It's also a really loaded question. My first thought is that, you know, you enable emotional damage, right? And the way I most see that happening is by opening up a trauma wound and not being able to kind of close it before someone leaves. And I do see that as one of the biggest differences with what we can do in what is most commonly 16 to 20 minutes and what someone can do when they have 55 minutes. And that to me also comes from laying the groundwork with our clients ahead of time. To just say really clearly, I feel like we can work together on helping you with your anxiety and your depression. We could work on some skills and some approaches. And I really just want to provide you a place to process some things in your life. What this really isn't a great environment for is really talking about things that are really hurtful or that are very sensitive and potentially traumatizing in your life, just because we don't have that amount of time together. So I want to be really careful with you, and I want us to partner together to make sure that if you feel like we're going down that road or touching on something that's going to be really hurtful, that you feel like you can put your hand up or kind of say, yeah, let's not go there. And so part of that is developing that relationship with the client ahead of time, that trust and shared decision making, but that trust where the client feels empowered to say, I'm starting to get the heebies thinking about my mom right now. Let's close that door and move elsewhere. And then that you respond appropriately to that and close the door and move elsewhere, you know? It's okay to ask your client kind of near the end of a session, are you feeling okay right now to go back out to the world? It can be hard to come in here and talk about your parents' divorce and then go right back out to the car where they're fighting. So do you want to take a second and like breathe together, scream, color, journal, eat a candy bar? What do you need to feel like you can go return to the world?
I remember you mentioning that in one of our coaching groups, and I really liked that because I think that's one of the anxieties I've had is like, what if I talk about some of these things and they feel worse? Like, I don't want them leaving our appointment feeling worse. And I remember you gave some strategies like that. And like, even I think you said, you know, what are you doing today? Like coming up with a couple of things, you know, for that day for them even.
Right. So. And, you know, you're a small part of their day. You were a 20-minute part of their day. So asking them, because they might feel worse, right? And we can't fully control that. Asking them, is there someone in your life right now you could go talk to if you're not feeling great? What can you do with the rest of your day to take care of yourself? Because this has probably been really hard today to touch on this subject. And let them identify, you know what, maybe I should go for a walk this afternoon. Maybe I should call my mom on the way home. Maybe I need to just go take my dog out first and then go back to work. The client's the expert on themselves. So ask them to help come up with their healing.
Right. I love that. Rather than like the TikTok that's going around. I don't know if you've seen it, where it's like after you've
Probably not.
It's like you waited 3 months for your psych appointment, and then they're like, don't forget to drink water. Don't forget to, I don't know what it is, Rachel, but the irony in it is like, that feels really icky.
It's like, and stop being sad. Like, don't do that or something.
Right.
Like.
Oh my gosh.
Yeah.
Well, and some of that is that partnership too. I also say to my clients, when you walk out of here, what's going to make this time together have felt important and helpful to you? I ask that question all the time.
I love that.
And so then I'm not sitting the whole dang time I'm talking to a client saying to myself, is this what they want? Is this what they want? Just ask them, what do they freaking want?
Right.
You know, and sometimes they don't know, and that's a whole other thing, but sometimes they do. They really do know what they want.
I love that.
That's why I love your series, What to Say Wednesday, on your Instagram. I think that's so needed because that really puts these principles into practical sentences that we can say. And I think that's where sometimes there's a disconnect. I think for me, it's like I've done so much reading and listened to so many podcasts, and I took a lot of classes in therapy in grad school and I had a great program, but then I'm like, but what do I say? Like, what do I actually say? I think that's the hardest part.
Yes. And thank you. I'm restarting my What to Say Wednesday series because it was very well received. I just need to catch up myself with the technology part.
Yeah,
but
follow Debbie on Instagram.
Well, yes, the Dr. Debbie, But when I've done a lot of teaching, and when I was teaching at this social work school, we were talking about asking a question about, actually, sorry, this was in a nursing school. When I was teaching at a nursing program, we were talking about sexual side effects of medication. And everyone was going around saying, well, if there's sexual, no one could even say the words. So we stopped and we practiced saying to a client, the reality of this drug is that it can have sexual side effects. That might look like, don't give a crap about having sex. Might look like, I'm trying to have sex, but it's not fun. It might look like, this is really fun, but I can't finish the job and it's been an hour, And so we really practiced like saying these things. And I think you're exactly right. And in my coaching and teaching, I talk a lot about, let's practice walking through this with words, because I've read in a textbook there could be sexual side effects, but I haven't practiced making that reality for my client and creating an environment where my client can actually say, dude, I can't have an orgasm. And that not everybody is red-faced during that conversation.
That's why I'm obsessed with you because like something like DBT, okay, dialectical behavior therapy. It sounds super fancy. For me, what it means to me, because I went through it in grad school, was just learning coping skills that I didn't have before, learning the mindfulness, learning the distress tolerance, emotion regulation. And it's the kind of taking that from okay, I know these things, but what do I say? How do I make it practical? That piece, I think you're amazing at that piece.
And I've worked on that piece for 30 years. That's been a very important piece for me.
It's huge.
Yeah. When you brought up one time before also having a similar conversation with students about asking about suicide. And that really struck a chord with me because despite having worked in psychiatry for 9 years at this point and asking those questions a lot, I still find myself sometimes tripping over the words in appointments. And then I work with kids and teens right now too, so I'm even more self-conscious about how I'm saying it and how I'm following up with it and everything. So I think just having those practice with those conversations, I think even when you've been asking those questions for a long time, I don't think it hurts to practice how you're going to say these things.
And we had this was also in that class, we had people kind of go down an assembly line, and everyone had a question having to do with suicide that they had to practice asking, because in our documentation, for the most part, we are writing no SI, no HI, no SI, no HI in almost every note. So are we actually saying to people, I just want to check in with you, because some people who are going through this amount of loss do feel suicidal sometimes. Is that you? Have you had these? Or I just want to check in with you. Some people who are experiencing depression on top of anxiety, it might be hard for them to say, this depression is so bad that I'm thinking about ending my life. And I want this to be a space where you can say that. Does it feel like we should have that conversation, or that you want to have that conversation? So just practicing saying.
Yeah.